Says South Africa's unprecedented lockdown measures have managed to slow the rate of infections and prevent hospitals from being overwhelmed. He says 429 people have now died from the coronavirus and that the number of infections now stands at 22,583. The president says 128 people are in intensive care with COVID-19.
There are now just over 11,000 active coronavirus cases in the country. Of these, 842 patients are in hospital and 128 of these are in intensive care. The number of infected people could have been much higher had we not acted when we did to impose drastic containment measures. We are consequently in a much better position than many other countries were at that stage in the progression of the disease. As a result of the drastic containment measures we've taken, we've been able to strengthen our health response. As of today, we've conducted well over 580,000 coronavirus tests and more than 12 million screenings. This is much more than what many other countries, especially on our continent, have been able to do. There are nearly 60,000 community health workers who have been going door to door across the country to identify possible cases of coronavirus. In preparation for the expected increase in infections, around 20,000 hospital beds have been and are being repurposed for COVID-19 cases. And there are 27 filled hospitals that are being built around the country. A number of these hospitals are ready to receive coronavirus patients.
For some analysis on the President's address, I'm joined by Professor Narnia Bohler-Muller from the Human Sciences Research Council. Professor Bohler, thank you so much for joining us. Welcome to the Globe.
Thank you very much, Simphiwe. It's nice to be with you.
Well, it's an absolute pleasure having you on the show, Professor. Now, first of all, what is your reaction to the President's address?
Well, I don't think that there were any major surprises. President Ramaphosa, in each of his speeches, is very measured. And he starts with having sympathy with the people, us, that he is speaking to. And of course, then we all had a feeling that we were going to go to level 3. And indeed we are, and huge sigh of relief around the country, 1st of June. But there are going to be restrictions, and he made that clear as well, not only tobacco, but I think that's going to be a really big issue going forward. The restrictions, however, are going to be far less than we've been experiencing now. And I've had people say to me, well, can I go to the beach and swim in the sea now? Is that considered to be exercise? And there's a slight feeling of just relief around the easing of the lockdown. It's been a difficult time, I think, the last few weeks. Initially, we were all very convinced that we were doing the right thing and we needed to be locked up. And one of our surveys that we did with the University of Johannesburg, in fact, saw that the lockdown initially had a 75% support from people. But slowly but surely, people are becoming more stressed and more fearful. And so it was really time for this to move to level 3.
You're quite right there, Professor, that there were no surprises at all in the President's address tonight. But then he did not give us an update with regards to how far the government has gone insofar as cushioning the poor and the vulnerable in South African society. And what then happens for them? In as much as some of the restrictions may be eased, but then there's still no word on how the poor should adjust.
You know, that was something that was absent in the speech, and I'm sure that that's something that's going to be picked up and spoken about a lot in the next week. There was an article in the newspaper this weekend that only 350 people have received the grants, the 350 Rand grants. And that's not good enough because, promises have been made. Government has said that it's concerned about the poor. And yet these grants are not being paid out to the people who need them most. The food packages took a long time as well because of a lot of red tape and bureaucracy. And now people are receiving their food packages, but they spent a lot of time waiting and, in essence, going to bed hungry as a result of that. So, yes, he didn't say anything that would really address the plight of the poor. I think tonight was more along the lines of the economy is going to be opening up, and therefore we're going to start seeing people go back to work. It must be safe, however, for them to go back to work. And because the economy is opening up, we're going to see less people who are jobless, who aren't able to earn a living because they're not going to be able to go to work, such as domestic workers and gardeners. So in that sense, it's indirectly addresses the plight of the poor because people can go out now and seek work again. But the main message really was to be responsible. And I guess that's the message that we need right now. He said, he used the quote from our former president, Nelson Mandela, "It is now in your hands." And it literally is in our hands now, because as we open up, we can see that the infections are also rising. And so if we aren't responsible as individuals and as society, and if there isn't some form of social cohesion that is developed over this time, then we are going to look at an absolute bloodbath when it comes to this virus. Yeah. So I think that was what he wanted to bring across. Well, that seemed to be the message that he really wanted to bring across very strongly.
You know, Professor, the wide expectation was that a blanket approach would not be applied across provinces in terms of, migrating to level 3 with the wide expectations that Cape Town, or rather the Western Cape, since it is the epicenter of the virus, would remain on level 4, and some provinces like the Northern Cape, for instance, which still have the lowest infection rates, would move to level 3 or perhaps level 2. So what do you think the President's reasoning was in applying a blanket approach towards moving to level 3?
Well, I think it was quite a clever way of dealing with it to say that the whole country is moving to level 3. However, these are the hotspots. And these hotspots are going to be monitored very closely, and they are going to be dealt with differently. So we may call it level 3, but we could probably more likely call it level 4.5 when the regulations come out. Because, of course, whatever the president says is broad strokes, but the regulations is what we need to look out for and see what is going to be done in the hotspot. Obviously, there's going to be a lot of attention paid to surveillance, tracking and tracing in the hotspots. So it's not a matter of a blanket approach as far as I'm concerned. It's just not calling it level 4. And he did mention later on in the speech that these hotspots, if things aren't working out well, could revert back to level 4 or even level 5, which is quite a horrible thought.
Yeah. All right, Professor, great chatting to you. Thank you so much for your thoughts and for your reflections. Much appreciated.